We're ready for our first presentation, Staying Fit as We Age, and we've got Curt and Alicia and Jen and another Alicia, so we'll turn it over to you.
Welcome to Mayo Clinic Health System, Cannon Falls, or what a lot of people are starting to call this the hospital on the hill. Great view, but thanks for coming. This is your hospital. A lot of people have made a lot of commitment to it, so feel free to look around if you haven't looked around prior to this. Myself, I'm Curt Beissel. I've been here for 23 years, long enough. Physical therapy. Alicia, if you want to introduce yourself.
I'm Alicia Bonderson. I'm a physical therapist here as well. I've been here for just over 2 years, so I'm as long as Curt.
I'm Jen Fogarty. I'm also one of our physical therapists, and I've been here for 11 years.
And I'm the other Alicia, and I'm the cardiac rehab therapist, and I've been here for just a year.
Good. So, what we're going to talk a little bit about today, and maybe you're interested in this, some people may not have thought about it. As we get older, we kind of let things slide a little bit, if you will. Exercise. How active are we really? Are we active? Does everybody out there think that they're healthy? Do they think they're active? What do you consider active? How many people get up in the morning and do something first thing, or someplace in the middle of the day, or sometime in the afternoon, they actually get up and do things just for their well-being? Exercise. Raise a hand. Very good. Very good. How many people are pushing the limits on that a little bit? Okay. There's one thing to do it once, twice a week. There's another thing to be doing it 5, 6 times a week. And huge difference there. Those people that say, you know, I'm active, I do things once, twice a week, probably not enough. Not enough. Okay. You got to do more. Just to give you an idea. Let's look at just calories, calorie consumption, calorie burning of calories. How many calories equals about a pound of fat, a pound of weight? How many calories do you think it takes?
I think at 32.
You're close, 3,500 calories per pound. Okay, that's quite a bit. If you do nothing else but do what you're doing today, if you're maintaining your weight right now and you do nothing else, you'll continue to probably maintain your weight. However, as we get older, our metabolism will continue to slow down. We'll probably continue to gain weight even though our activity remains about the same. Just out of pure genetics, aging, we'll continue to gain weight if we do nothing else. So as we get older, we need to do more. Kids that are young and healthy, their metabolism is high, they're naturally active, they're going to burn weight no matter what, it seems. Of course, you see a lot of kids nowadays are in front of video games, they're in front of computers. You're seeing a shift going the other direction that way as well, so we have to be active. Just to give you an idea, let's just say someone's cooking, just normal cooking, and this is for a half hour. These are activities for a half hour. This is actually for a person my weight. If I was to get up and I was to cook for a half an hour, how many calories do you think I'd burn? Just throw something out, give you an idea. And this is going to be pretty general for everybody. No, about 84 calories. You're giving yourself way too much credit. How about ironing? Kind of along the same lines, right? 96 calories. Vacuuming. Vacuuming is a little bit more aggressive, a little bit more activity. How much of that half-hour vacuuming do you think, how many calories?
300.
Well, not quite. A little about half that, 147 calories. Okay, so a half-hour vacuuming. You know, it sounds a little, it's a little unnerving in the sense that you think you've done more, but you really have to put that time into it. And as we get older, we don't have to go out and we don't have to be real aggressive with our activity. We just have to be consistent and steady with it. So you have to put in the time.
How much vacuuming
That would be, depends on how much dirt you got. You know, it's, what they really mean is that you're going through the motions for that duration. So if you're going from room to room, you could probably do I don't know, what's it take to do maybe 5 rooms. You probably won't have that much vacuuming to do in a day. And some people might too. So, but it's just that half hour of doing constant motion, that type of motion. How many calories do you think you burn at night? Just sleeping. You burn about 38 calories per half hour, so that's about 76 per hour, about 600 calories per night in an 8-hour night. So you actually burn calories when you're sleeping.
Even if you're restless, that's all you
Well, yeah, I don't know. You got restless leg syndrome? I don't know, maybe 1,000. It really depends, you know. So anyways, just gives you an idea as to what type of calories you're burning out there. The other thing as we get older, you know, some people may be a little bit more, they say, you know, I want to get up to my target heart rate. And people probably haven't heard of target heart rate. There's target heart rate and there's maximum heart rate. Maximum heart rate, there's a formula out there, and I can get that to you, it just occurred to me. You take the number 220, that's a constant. 220 is constant, you subtract your age from 220. So for me, I'm what, 20 right now? So, actually I'll say 50. You take 220 minus 50, okay, that gives me 170. That is my maximum heart rate. Okay, and everybody can subtract their own age from 220, whatever you get, that's your maximum heart rate. From that point, you want to take about 75% of that. So for me, 75% for me is 136 beats per minute. So that means when I'm exercising, I want to bring my heart rate up to about 136 beats per minute. And that's for people that are interested in really getting into some conditioning for their cardiovascular conditioning. And as we get older, how important is that to people? I don't know if it's necessary that people have to go out there and do that constantly every day. I think as we get older, you know, we want to make sure we're doing something that we're being active. Okay, for a half hour a day, just making sure we're going out and doing something physically for a half hour. But if there's people that are interested in getting into their target heart rate, there's that formula that you can use, and you want to stay in that range for about 20 to 30 minutes to build cardiovascular efficiency as well. Okay, it comes with just being active too, but there may be some goals that people want to achieve at certain ages where that might be a little bit more important to them as well. Okay, so with that, I'm just going to let Alicia kind of step in here and she'll talk a little bit more about exercise. Okay?
So I'm going to start off by handing out the physical activity guidelines for Americans. So the American Journal of Lifestyle Medicine says that an active lifestyle is a healthy one, and inactivity is hazardous to your health. The World Health Organization estimated a cause of 2 million deaths worldwide annually because of inactivity. So that's quite a bit for people who aren't trying to keep themselves in shape and having a healthy lifestyle. The handout that's coming around, this is the physical activity guideline sheet, and it highlights how much activity one should be doing as an adult per week. So as you read through it, you're going to see that an average adult from age 18 to 64 should do about 2.5 hours of moderate activity a day. And then if you think about what moderate activity is, that's rating from a 0 to 10 scale of how hard you're working. That's about a 5 to a 6 on that scale, okay? If you were to do vigorous activity, that's rating it at a 7 to 8, okay? So whatever activity makes you work that hard is something you'd want to do, and everyone's different because all activities are going to be, you know, either easier or harder for each individual. Then they also say that you should be doing about 2 days a week of actually strengthening to hit every muscle group in your body. So you're not just doing the aerobic activity, but you're also doing the strengthening activities that are going to work your muscles, and also then the muscles pull on the bones to cause that bone to become really strong. And that's one of the big reasons why they want people doing the strengthening activities as well. So for older adults ages 65 and older, you're going to want to go by those same guidelines, but you then have to think about how your health is personally. And if you have any problems such as heart problems, you're going to want to talk to your doctor first, or your physical therapist, or your cardiac rehab therapist, and make sure the activities are going to be safe for you to do so you're not overexerting yourself. So another thing from the Centers of Disease Control and Prevention, in 1990, the BMI of greater than 30 was less than 10% for Minnesotans, but in 2008, actually that went up to 25% of Minnesotans who had a BMI greater than 30. And so a BMI greater than 25 is overweight and 30 is obese. So as you can see, inactivity is becoming more of the norm, and BMIs are creeping up steadily as time goes on. So I'll let Jen talk about falls a little bit here.
So today I'm going to talk a little bit about falls. How many people have had a fall in the last year? I have myself, not so graceful, but it can happen to anybody at any age. And unfortunately, as we age, it tends to happen more frequently. I've got several handouts for you here. The first one is from the Center for Disease Control. On the inside, it actually has a checklist, and kind of go through it. It'll go through your house and identify areas where you may be at risk. Different things that could cause falls, cluttered furniture, rugs on the ground, cords, different things that you can think of. There's also those risk factors that we're doing that we maybe don't want to give up, like climbing a ladder to reach something, getting up in those upper cupboards. So kind of watch your risk. Take a look at this, go through your house and see where that risk is, because these are modifiable. You can prevent those falls. I've got another handout here. This one is from Mayo Clinic about preventing falls at home. So each year, thousands of Americans, older adults, fall at home. In 2002, the Center for Disease Control found that 12,800 people over the age of 65 actually died from those falls. And another 1.6 million were treated in the hospital for those falls. Another handout here, the last one, I promise. This one's on nursing homes. I don't know, some of you may have friends or family members that are in the nursing home. 1,800 older adults in the nursing homes die each year from fall-related injuries. And those that survive often have permanent disabilities, such as hip fractures. They may have head injuries that may impact the quality of their life. So some key facts. Falls are the second leading cause of accidental or unintentional injury of deaths worldwide. As you kind of look through some of these handouts, if you go in there, they'll talk about more of those modifiable risk factors, things we can change. Mayo Clinic has a little checklist as well of kind of going through your home. There's also those risk factors that we just need to be aware of to minimize the risk, different things that might be affected by your health. So in there's a whole bunch of them. If you have any numbness or tingling in your feet, weakness, if you have decreased range of motion, those are all things that we can do to kind of help you in therapy to minimize that risk. If we make you stronger, improve your mobility, using assistive devices like canes and walkers can also minimize that risk. In therapy, we actually have tests that we can do to see what your risk is and where you're most at risk to help minimize that for you. A couple little stats for you. Adults older than 65 suffer the greatest number of fatal falls. 37.3 million falls require medical attention because they're severe enough. Prevention is the biggest thing that we can do to minimize that risk and maintain your quality of life. So take a look at those checklists when you get home today, go through them. If you have concerns that you might have something that we can help you with, certainly let your doctor know. If you feel like you're weak, or if you feel like your range of motion isn't as good, or you've had a couple falls, bring it to our attention and we'd be glad to help you with that. Okay? Next we'll talk about the cardiac rehab side.
Oh, hold on a second. Can we just go through that?
Oh, sure.
I just want to federate. I'm going to have just kind of do a little test that you don't have to do it here. You can do it in the privacy of your home, but I'm going to have a subject. I'm going to take someone that wants to volunteer for a little test here. Tell you what, Steve, why don't you come on over? You're the next contestant. This is just a simple test that you can do when you're at home. If you feel unstable doing it in the first place, you want to ask maybe to have someone stand next to you, but that may already give you some indication that you may have an issue with falls or balance. Okay, Steve, why don't you have a seat right here? Let's give a big round of applause for Steve. A simple test, it's in the handout there, guys, and what you want to do, you want to make sure you do this correctly. And Steve, I'm going to actually roll this right back to the wall if we can, okay, so it doesn't slide. You're going to find yourself a chair at home, a stable chair with no armrests on it.
Paul should do this.
What's that?
Paul Schluter, he's
Oh, is he
You're
You're going to do just fine. But make sure the chair is very stable, it's not going to slide away. You don't want armrests because that gives you too much help. Now, if you need to do this with armrests, if there's no way of getting up out of a chair without armrests, it already tells you that you've got some higher level risk of falls. Okay, pretty indicative of that right away. But in this situation, what we're gonna do, we're gonna have you stand in it, sit in a chair, feet stay real close to the back of the chair. You're not gonna have them sticking straight out in front, but where you got good leverage to come up. Your arms are gonna stand straight, right across the shoulders, just like this. Did you already look at the sheet?
No, the health fair had it.
Oh, is that right? Okay. So you have 30 seconds, and from the time you say go, you're just going to count how many times you can go from sit to stand. And you don't have to go crazy with it. But when you do stand up, you don't want to just come up halfway. You want to come all the way up, stretch those legs out, and sit back down safely. Okay. This is a test that's allotted enough time for you to do them safely, and that the test is fairly reliable. There's no test out there that's going to give you 100% conclusive here. Okay, but it will give you an indication as to where you might rank with the norm. Okay, so in this situation, we have a clock here. We need to get a clock.
Somebody have a
You
min
want to tell them to start, Bill, and then when 30 seconds is over, you want to just tell them to stop. So when you're ready to go, stretch all the way up.
And they do have a legal ailment too.
You do it. We don't need to hear the excuses now. Okay, when you're ready.
Okay.
You're doing great.
Oh, well.
Hey Kurt, what if my clock stopped? Is that
And we'll double the number.
and stop?
How many do you have?
10.
Yeah, I think I had that down. Where did I put that? I had it on my sheet here. I just handed it out. Where's the schedule? Did I give everybody one? I just can't find my file here. Oh, here we go. Right here, I think. No, that's not it. That's the schedule. Did I put it right here? Oh, here it is. It's okay. So, you got 10? You want to volunteer your age or 50? You're not on here, so we don't have to worry about it. But on the back, there's a norm scale. Okay. You're going to be just fine. But there's a norm scale of what you look at. So for someone 60 to 64, they'll say people less than 14 a minute. You weren't pushing it very hard. You're just trying to show an example. I'm sure you could go faster. No? Oh my gosh. But 14 is the norm for people that are 60 to 64. If you're under that, then you might have a higher risk of falls. Okay. And as you go down with age, the number goes down as well. There's a point where men and women are the same at 85 to 89. I don't know if there's any significance with that. But just in general, something to pay attention to. Thanks, Steve. So you can go home and try it and see how things go. Now, like Steve has a bum knee, and that does affect it too. So you have to take all that into consideration as well. There's other factors that play into this. But if you have good joints, and if you're in good health, trying this exercise, it might give you some indication. Okay? So keep that in mind. The other thing is, there's exercises involved with this. And I can send these out. I don't think I've sent this around. Oh, you did. Thank you. These are just some simple exercises you can do just to help work with your proprioception, your balance, and strength. Okay? Sometimes balance is related to just strength, weak legs. Okay? Maybe you need to condition and strengthen the legs a little bit. There's another thing, if you look at your balance, it's related to, what is it, the 3 senses for sure, vestibular, inner ear. Okay? You have issues with your inner ear, something going on there. Vision. Okay? A lot of our balance is dependent upon vision. And also sensory neuropathies. If we have neuropathies as we get older, that's pretty common. Diabetics have neuropathies. So if we lose that, we lose that edge of knowing what we're doing with our balance. That all plays and contributes to what we can do with our balance. So think about that. These exercises, they start out relatively low level, and then we ask on here that if you don't feel comfortable doing it by yourself, that you have someone stand with you and do these. But it starts out just as simple as standing just like this at the side of a table, okay? And if you can do this, then you put one foot in front of the other, and you let go, okay? And see if you can balance. And then you work yourself up to one leg at a time, okay? This will probably be plenty for most people, okay? Switching out feet. And it kind of walks you through it. That's the first one here, I believe, if I'm not mistaken, okay? And then eventually there's progressions to that, and that is you do it when the lights are darker. You do it with your eyes closed, and that's almost impossible for most people, especially as we get older, So, but these are exercises you can do. There's another one here, just the same. Squatting exercise is probably the biggest thing you can do. Standing on a side, standing in a walker, and just doing some standing up and down, really working those quads. Quads, the leg muscles are the largest muscle groups in the body. They demand a lot of energy. You're going to tire relatively quickly because it is such a large muscle group. But in this situation, it's setting aside time, 3 sets of 10 repetitions every day. Be a great thing to do. After 10, rest for a minute or two, do another set of 10. Or do what your body will allow. If you have joint pain, that's gonna limit you. But try and modify your activities to what you feel and what you can and cannot do. Okay? Yeah, John.
Curt, can you talk a little bit about degeneration of muscle tissue? Is that what you're talking about basically there?
Yeah, that's a good question. As you get older, you might think that you atrophy. We lose muscle tissue. You'll never lose, muscle will always stay muscle. A lot of people say, oh, look at that, it's gone to fat. Well, it doesn't go to fat. It's still muscle tissue. The only thing about muscle tissue is the cell fibers have gotten smaller. And that's why we say, believe it or not, at any age you can build muscle. It doesn't matter. It's shown people at 90 years old, they start an exercise program, they build muscle, they increase tonicity. So don't feel like you're going down this downhill slope and you can't return. You can't. We won't ever get to, Arnold Schwarzenegger will never be as big as he was when he was in his 20s, but he'll still be able to condition and tone and strengthen. So, that answer your question, John? Okay.
Can I just add one more thing? Talking about exercising, the evidence for having increased physical activity, there's a lower risk for early death, for heart disease, stroke, type 2 diabetes, high blood pressure, high cholesterol, and colon and breast cancer. So those are things to think about. If you're keeping yourself better physically active, you're going to lower those risks for those medical problems that can sneak up on you. And Alicia will talk more about that, okay?
So, I'm the cardiac rehab therapist, and I usually see patients after they've had a heart attack or a stent or open heart surgery. But what I'm going to try to do today is to create some awareness so that we can prevent that in the future. Does anyone have heart disease that runs in their family? Yes. So that is a risk factor in itself, but that's something we can't do anything about. You can't do anything about your family history. So what I want to do today is just create awareness on things that you can modify yourself so that you can lower your risk for heart disease in the future. Does anyone know what a risk factor for heart disease is off their top of their head? I'll hand out a list, but before I give you the list of them, can anyone name something that... Yes, very good.
What was that?
Smoking.
Drinking.
Yep, cholesterol, drinking, yes.
Watching TV.
Well, inactivities. Very true. So there's quite a bit of them. So what Jen is going to be handing out is a list, and this is not a diagnostic tool by any means, but it just goes over all the different modifiable risks for heart disease. Now it's a packet. There's a couple surveys that are involved, a nutrition survey and a depression screening at the end that you can kind of see if you're at low risk, medium risk, or high risk for each of the 8 modifiable risk factors. So as Alicia went over earlier, weight or BMI is a big risk factor for heart disease. Now there is a BMI chart in your packet. That's the first thing that's after the risk factor assessment, and that is just so you can calculate your own BMI without having to use the equation. So weight alone is a risk factor. So if you're overweight, that increases your blood pressure. It shows that you are maybe not as active as you could be. Your cholesterol is probably a little higher. So it all kind of, it goes all together. So you'll calculate your BMI on this risk factor assessment, so that's number 1. And then you'll ask yourself how many minutes per week do you exercise. So as they went over, exercise is very important. On here you can see that low risk, it means that you get over 150 minutes of exercise a week. And high risk means if you get less than 150. So you really have to see, how much are you physically active throughout each day. It's important, they suggest anywhere from 3 to 6 days a week of getting some purposeful, meaningful, continuous exercise. So it's important, anything is better than nothing. So getting moving is very, very important. The next one is cholesterol. So I first asked you, do you have high cholesterol? You can answer yes or no to that. And the next one is if you take medication. So if you look below, you can kind of see what qualifies as low risk, medium risk, and high risk for your cholesterol readings. And if you are taking a cholesterol lowering medication, you're already at medium risk. So you kind of can see that in the medium risk aisle. Yes, like Glenn said, smoking does put you at risk for heart disease. So if you are a current smoker, really think about that, because that is one thing that you could do to significantly reduce your risk for heart disease. And also drinking. So those are two. And then if you are diabetic, that already has you at risk. So there's not really much you can do if you're type 1 diabetic. So the main thing is just to keep those blood sugars in control. If they're out of control, it really does have a toll on your heart and your body. The nutrition, the survey is on there. When you get your score, you can kind of see where your low, medium risk is. They suggest lower fat, lower sodium options for a heart-healthy diet. Now, lower sodium is the main one because if you eat a lot of salt, your blood pressure does go up. So I know that might not be the most tasty thing to think of low fat, low sodium, but it is the best for you. So just find things that taste good and find better options, because they do have lots of things out there that are good for you but still taste good. Just find things you like, because at that point, we're not talking about a diet here. I think the diet kind of implies that you can stop it at some point. It's more of a lifestyle change, so just finding little changes to make is always a good step forward. Depression is the other survey. We want you to not only be physically healthy, but mentally healthy. Emotionally, you want to make sure that depression does affect your heart, so making sure that you get that under control is important as well. And the blood pressure, it has what puts you in low, medium, and high risk, just like everything else on the bottom. The main question is, do you have high blood pressure, or are you taking medications? If you're taking medications, just make sure you take them regularly. Exercise does help lower your blood pressure, and lower sodium diet, like I said. But the main thing is, having high blood pressure you don't have symptoms of having high blood pressure. So you can't tell if you do unless you get it checked. So that's the most important piece of it. To make sure that either your doctor is checking it or you can get it checked at a pharmacy. Just make sure that you're kind of aware of where you are on that risk. That's huge. I know there's a laundry list of things that you can do, and I know that maybe if you rate medium risk and high risk for a lot of the things, it seems kind of overwhelming on all these changes that you should make to better your heart. But the main thing is just not to get discouraged. If you just take one healthy step, you're one step closer to a healthier heart. Don't feel like you have to make all of these changes right away. It all makes a difference. Any questions?
I think, does everybody know what a high blood pressure is? What do you consider high blood pressure?
Have it.
240.
Yes.
Just to give you an idea, the American Heart Association says, and correct me if I'm wrong, is 120 over 80? And
Well, it
above
says
that?
on your low risk is less than 120 and less than 80. So you have to have both numbers.
I thought they raised that for older people.
They said every after 60,
Yes.
every 10 years, it can go up 10 points.
Yes, but they still
I realize your economy should always be the lowest, but they have realized that a little bit, haven't they?
There's a little bit of leeway. I mean, if you're 130 over 82, they're not going to put you on medication for that. That's where you have the lifestyle modifications that you can do to lower it, such as low sodium, such as exercising. If you're over 140 and over 90, that's when they put you on medication to modify your blood pressure. So if you're in the high risk of that, that's when you would do something about it. But if you're kind of in between what they call pre-hypertension or pre-high blood pressure, that's when you would just do those other things to modify your blood pressure instead of medication. Does that help?
So basically what we're just trying to say is get out and do something. Right? Long story short, do something. It's for your own benefit, it's for your own good. And it's not once, twice a week, it's 4 to 5 times a week for sure. If you can do it more than that, you can keep hold of the Sabbath if you wish, but 4 to 5 times a week would be really ideal. And you'll find most people with larger frames bigger bone. It's a kind of it's a norm. It's not specific to everybody, but if you take the general, what they call morphology of the person, where they take the average person, you're bigger bone, you're tall at height, you're more muscular, you're not going to fall in that category of body mass index, that number. And then there's some people that are going to be real low with it because of it. So you have to kind of take that into consideration too. If you really want to know, you really want to do a body mass index through volumetric measurements where actually use buoyancy to check what your body fat is, that sort of thing. But just in general, it kind of gives you somewhat of a guideline. If you're way off the charts, then you might have an issue. Yeah.
Keep in mind, we don't just look at one thing. We look at your BMI, we look at your activity level, your blood pressures, your cholesterol, and all of those things together help us determine those people that are at higher risk.
How about walking, is that any good?
Yeah,
Wonderful.
it's a great exercise.
How much, how long, what is it?
It's different for everybody. I think it's important to start slow and see how you tolerate it, and then gradually increase as you're able. It's always good to have somebody to do those things with, because they'll help keep you compliant. You have to account to somebody. Doing it at the same time every day, kind of getting a habit. Like Curt said, doing it multiple times a week, you'll be much more likely to stick with it.
And even in the winter around here, they can go to the school, correct?
Correct.
Walk around, so you're
The
not going
schools-
outside in the cold or the icy roads.
And walking is good for your bones too. For those, as we get over 65, you're more at risk for osteoporosis, so I think it's important to maintain that as well.
The school is open during the, sports have precedence over it, but during the school hours itself, it's open from 8 o'clock in the morning until, I believe, 10 o'clock at night. So you just have to go through the district office, but it's a great place to go and walk, especially in the winter months.
Curt is going to mention, as part of our Shepherd Center, you probably aware that we had senior softball this year for the first time. We had 27 people playing. And what I noticed as an old coach and just observing when we started and when we got done, where people were forcing themselves to run and do things they hadn't been used to, they were more physically fit. When we started in June and we ended in August.
Sure. And the changes, you're right, they come relatively quickly.
Right.
And you're going to be sore. It depends how you work into it too. I'm assuming that you're probably sore.
We were all sore.
But if you work into it gradually, the walking programs, to have pain, if you do it right, you shouldn't have a lot of pain. You may be stiff the next morning, that sort of thing. But, if there's pain involved, that's a whole different story than just having muscle stiffness. Okay. You may have a little bit of joint pain if you have arthritic condition, so you have to kind of, if that's the case, you might have to say, okay, maybe this exercise isn't the best for me. Maybe I have to look into something else. But if you're not arthritic, starting out on a program such as walking would be just probably one of the best exercises out there.
Okay, one more question. Because often when you're underweight, you don't have that strength. And so again, going back to that fall risk, those patients are at more risk of falls. They typically will have higher risk for osteoporosis and be more likely to end up with those fractures.
They're probably not getting the nutrients they need to actually keep their tissues strong and healthy. So that's one of the big things if you're underweight.
A grabber works great for getting spiders off the ceiling.
There
Right
you
where you
go.
want to climb on a chair.
Yes, I can't tell you how many patients I've seen because they've had falls, because they've climbed up that ladder, they've stepped up on that chair. Yep, use those things, ask for help, people want to help. I know it's not an easy thing to do, but they want to help, they just need to know what to do.
And don't compare yourself to someone else. If someone is doing more than what you are, so be it. And, this is where you're at your level, and you need to progress from that point. But don't get frustrated with exercise. Make it fun. And sometimes, I'll be honest, sometimes exercise isn't fun. It's just something you have to do, and that's set aside a time during the day, every day, and stick to it. That's the most important. There does get to a point where guilt will drive you. Believe it or not, you'll know that you've been doing well, you'll feel well, and if you stay away from it, guilt will drive you to get back into it.
And when you do it, you will feel better physically and mentally. So your body releases endorphins when you exercise, and that is positive energy for you.
Well, thank you very much for coming. Do you have other comments, Curt? I'm sorry.
No, I'm good.
Okay, well, very good questions. We really do have an excellent rehab department here at the medical center. So we have physical therapy, as was mentioned, occupational therapy, speech therapy, and then the cardiac rehab program. And we've really been seeing those programs grow. Certainly, we would like for you to visit and use our services because we do have a wonderful staff with a lot of different backgrounds and a lot of different interests in their areas of expertise. So we're really happy to have each one of them here. And they did a wonderful job this morning, so